Good afternoon, ladies and gentlemen. What a pleasant sight to see this room full. I can't help but go back to the first year when we did the shock symposium. We had a total of, I think Marwan can correct me, about 200 people registered for it. And this is in our fifth year. We have over 1,200 registrants and more than 45 faculty. Now, whenever I'm in the chairs meeting or talking to the university people, they say, "Oh, BK, how did you pull this off? It's such a nightmare to do all these things." I said, for me, it's very easy. I just have to have a number of one individual. His name is Marwan Jumean. I just need to call him, and he does the rest. Literally, this whole program is done by an effort of one single physician, that is Marwan. You would see him. He's got an incredible talent to do something like that, and I had nothing to do with it. Of course, ably supported by Kansi, Neha, and Jill, which form the core group of people who have done that. And I want to thank each one of them for pulling off such a spectacular event. So over the next few days, the philosophy behind this shock symposium was, as you know, the mortality of shock continues to be very high despite all the advances that would happen in all the allied fields. So this was to have a free flow of ideas, to debate ideas in an informal setting. And that's why if you see the talks are very limited, few minutes, and there's enough time for discussion. So that we can evolve a consensus and then take it to fruition. As you know, there is not a randomized controlled trial in cardiogenic shock. We don't know what to use. Everyone has their own favorites and own ways of treating it. But I am reminded of, and we never find a solution, but the field moves forward. I'm reminded of a French philosopher, Joubert, who said it's better to debate and leave things unsettled than to settle things without a debate. So I think it's very important that we all participate in this, because cardiogenic shock continues to be one of the biggest challenges what we face these days. And clearly there's a dearth of knowledge and evidence, and we are trying to build that. And this is a very humble effort to try to do that. So I want to welcome each one of you for this, I would think, a very fantastic meeting, which is really getting into the national map, because there are very few programs where it's dedicated to shock in general and cardiogenic shock in particular. So I think you will find your time very valuable, and I'm looking forward to meeting each one of you informally during the meeting and catch up with old friends. There are so many familiar faces here. And I want to thank you for joining us here, and I want to give the stage over to Marwan. Thank you. Marwan.
Thank you, everyone, and welcome to the 5th Annual Houston Shock Symposium. Thank you, Dr. Carr, for a sweet introduction. Just a few things. Again, we started with an idea in 2017, and this is where we are now. I think it's safe to say that we are the biggest shock conference in the nation. Our faculty continues to grow. We have over 100 faculty and case presenters this year. We surpassed 1,000 registrations for this weekend. This is, again, supported with our industry partners who help us move the field forward. There's a lot of chatter about Houston Shock. We monitor this, and we notice that there's a significant uptick in our new hashtag. I'm trying to understand the new language with the help of some of our social media catalysts. But really, I'm not here to talk to you about this shock and, ideas and clinical trials and so on and so forth. I just want to paint, the next 3 days with the notion of why we are here. What motivates us to be better and push the field forward. And it's not about fame, glory, or publishing. It's about our family, our loved ones, and our patients. So I don't want to speak anymore. I'd like to introduce you to a couple of our patients, and I want you to hear from them their stories. The first is Megan. Please, Megan, come up on the stage.
I knew I was going to trip. I knew it. All right. Okay. Hi, all. My name is Megan Holcomb Stapleton, and today I am here to talk about gifts. The Oxford Press University describes gifts as a special ability to do something, but most of the definitions of gifts include without compensation. And I know you all deservedly get paid for your special gifts and talents, but the truth is, patients can never really compensate you or repay you for the gifts that you give them. And for me, this gift especially was time. In 2017, I was 37 years old, a mother of 2 very young children, a wife to an incredible husband of 8 years, and I was also working and an advocate in education policies. In fact, in the summer of 2017, I was just about to finish up my PhD, just needed to turn in that pesky IRB before I could get my dissertation going. And right before I did that, I went to Australia to kind of take a break, went on a family trip for 2 weeks, and had the vacation of my life. It was amazing. On the way back, I had what was now known as spontaneous coronary artery dissection. And what happened was somewhere over the Arctic Ocean, I felt a piercing arrow go through my left arm, and I lost all feeling in my fingertips. I remember hitting the tray in front of me and not feeling it. If you've ever lost a sense, you can know how disorienting that is, like to be seeing something hit but not feeling it. It was quite scary, but we didn't think I was having a heart attack because that just doesn't make sense. So 2 days later, I returned to work, and we have this lunch bunch group that walks every lunch because normally we sit in cubicles all day, and I became winded. I wasn't able to share this really weird story about what happened to me on the airplane, and I began to sweat pretty badly. So I went to my car and had the AC directly on my face, and I started getting dizzy, incredibly dizzy, where I thought I was gonna pass out, and got really, really scared. I immediately threw up, and luckily I had a coworker see what was happening, and so he came and he called 911. By the time the ambulance came and the EMTs arrived, my blood pressure had returned to normal, and there was no unusual EKG activity. Because I was so scared, stressed, and anxious, they thought I was just having a panic attack, and they didn't want to take me to the hospital. I might have said some choice words to them, and so they agreed to take me to the hospital. I'll just leave it at that, because I was very scared. But I was triaged with having a panic attack, and when you look up my records, it says no cardiac issues present. So they sent me back to the lobby with my husband, and we were sitting there looking at pinched nerves, trying to figure out what's going on, because having a heart attack just did not make sense. And I remember the doors opened, and there were several people coming towards me with the bed, and I was like, I knew it! I knew I was having a heart attack. So it was confirmed. I had a troponin level of 4 that immediately rose up to over 44 that night. So everyone knew I had a heart attack, but no one knew why. We didn't know, nothing was really giving them any indication what was going on. I was told I was a walking time bomb, and traditional diagnostic methods were just didn't catch. So during my angiogram, my LAD completely dissected. And if it weren't for the skill, compassion, might add stubbornness of the doctors, nurses, and the staff in my heart cath, I would not be here. But I was kept alive and given the best care possible. I was flown to the medical center where I was intubated on ECMO and sustained only through machines. That night I had an emergent double cabbage, and while at first it looked like the surgical interventions, and I had many, were working, at some point when we were weaning off milrinone, I began to get incredibly sick. So at that point, we learned that my heart just wasn't strong enough to pump. It just wasn't working. I was placed on the list for a transplant within 3 days. Luckily, they had done a lot of this background work while I was sedated. And I received my gift within 5 days. It was yet another miracle that kind of came my way, and another gift that I did not deserve. The transplant was a success. I was able to celebrate my son's birthdays in the hospital. Look, they're so tiny. I love that picture. You can see the transplant was still pretty fresh. They both had birthdays right around my transplant time. But I did finally get to leave after some minor rejection issues. It just was SCAD broke my heart, and I needed a new one. So now I'm almost 6 years post-transplant, 6 years this summer. My very young, cute, adorable boys have grown up strong and tall. My oldest is taller than me, and I've gotten to see him fall in love for the first time, in fact, tonight is prom, and find a life passion of playing the drums. My youngest loves the outdoors, and I put up with nature to make memories with him. I was even his cub master. But he loves theater, so we watch TV shows and plays, and he's going to be in The Little Mermaid this summer, and I can't wait. I finished my dissertation, so I'm officially a doctor. I was very excited. Woo! Yes, you all know that works, so thank you. I beat COVID, and I've traveled to 4 new countries, including a new continent on my wonder list, and I'm going to 5 countries this summer. So I'm alive and living, okay, I'm gonna try not to cry. This is where I always cry. I'm alive and living the best life possible thanks to the education, equipment, and experience and the gifts that my doctors and my staff have given me. The gift of a stranger. I have more time, and for me, there's no better gift than that. I honestly have no way to pay back everyone involved in my care. Thank you. I wish I could even find the best words to convey my gratitude, but these words will have to do. I sort of joked at one point that I was a 1 in a million. I did some statistical analysis and read some studies and figured out what happened to me is incredibly rare. And when one of my doctors joked and said I'm more like 1 in a billion. But truth is, I could honestly be any one of your patients. You have the power to make a difference in the life of someone else with your gifts. So you have the ability to give time to someone else. Thank you for listening to my story, and enjoy the conference.
By the way, this is nerve-wracking. Following that speech is going to be a bit difficult. But mine happened almost 7 years ago. And to describe my personality was I was a wild man. I didn't know how to stop 24/7. I coached all my kids. My wife was a teen mom. I ran a very successful business, and I thought I was invincible. We had went to Hawaii, and I was out with my 14-year-old boy, and I thought, I think I ate some bad Mexican food in Hawaii. I wasn't feeling all that great, but I wasn't going to tell my son I can't. Because to my kids, I was Superman. And then I went to Panama on business. I was there feeling again a little pain. I had actually took my daughter to college, and I was going up and down the stairs, and my daughter said, "What's the matter, Superman? You can't go?" And I was like, "Nah, I just need some Pepcid AC." And I kept swallowing more Pepcid AC. And I said, "I think I need to make an appointment," but my schedule was too busy. It's important that you guys know that my family is everything. And when I was in Panama, I came back, we went to dinner. I had told my son, "Don't play video games after 11 o'clock. Well, he played video games that day till about 11:30, and he found me on my knees in the kitchen. He said, "Dad, you want me to get Mom?" And I said, "Now." My wife woke up, thank God. She said, "You want to go to the doctor?" And I said, "Yeah." She said, "Let me get dressed." I grabbed her arm and I said, "We don't have time." I knew this was it was bad because I had never felt like this before. So we take off. We didn't make it to the hospital. They had to drag me out of the vehicle. Then they saved my life there. And at the time, they thought, well, maybe they put a stent. 24 hours later, it was catastrophic. They life-flighted me to Memorial, to Hermann, where I met Dr. Jumean. I would rather have met Dr. Jumean and Nathan in different circumstances. But then I wanted to get up and walk, and I noticed I couldn't. I said, what's the matter? Why my legs are not working? Nothing was working. And I was not a happy camper. And then after a while, when they started saying, hey, you may have to stay here another 3 days, another 5 days, 103 days to be exact. I got the hours and minutes, but I'm not going to share that with you guys. It was 103 days, and I begged Dr. Jumean when he was by himself. I would say, can I leave to go watch my son's football game? I promise you I'll come right back. And he would shake his head and say, no. When I was in rehab, I would ask, can I please leave? And they would look at me and says, no. Well, I knew I wanted to get out of there for a while because I lost over 55 pounds. And I was not in good shape. I couldn't walk. I was bedridden. There was a nurse named Cody. He shaved me. He combed my hair. He gave me some of my dignity back because I did not feel that I was going to make it out of there. And it was difficult. And then the magic question was, why did this happen to me? At the height of my career, at the height of my life, my daughter's going to college, my other daughter's getting ready to graduate with honors. My son's a stud in soccer. My business is great. Why now? I couldn't answer that. But I asked God, why? And then it came to me. Everything that they did to me to save my life, I thank them every day. But I knew then I had to get out of the hospital because I had to buy my son his first vehicle, which I did. I had to be there for my daughter when she graduated, and I did. And then my daughter graduated from college, and I was there for that. I cannot tell you how tough this was for me, but I can tell you that I owe everything to the doctors who saved me. My oldest daughter is now engaged. I got to be there as a surprise. My middle daughter has just got a promotion and she's moving to Dallas. Hopefully she's not a Dallas Cowboy fan. My son's in 2 years of college. He's president of his fraternity. And now, because of what the doctors did for me, I'm able to enjoy life. Because I still feel invincible. I'm just a little bit more careful now. I will still try to run. I've played my best game of golf. And I am not going to let this change me, because I know in the back of my head, the doctors have done everything to save my life, and I'm here for a reason. But I had a lot of unfinished business to do. I since retired, sold my business. And I will tell you the biggest reason why I believe I made it out of the hospital was the love that I have for my wife. and my kids and my family. I could not be without them. It was a real hard struggle. I wouldn't change my life for anything except what I eat. But I just want to tell Dr. Jumean, thank you for everything the hospital and all the team did, because this was hard. Thinking you're a runner, you exercise, you do all the right things. Why? I can't answer why, but I can tell you why I got out of the hospital. It's the love for my family. Thank you.
This is why we're all here. Thank you, Oscar and Megan, for sharing this story with us. And I'll just play a short video and then we can start.